Chronic kidney disease is one of the most common disease in the United States and also in Chinese society population. The CKD stand for chronic kidney disease, divided to 5 stages. Stage 1, stage 2, stage 3 is significant renal damage, and stage 4 is kind of severe. And then if it develop to the stage 5, then you will need renal replacement therapy, including dialysis or kidney transplantation. So when you suspect you have the kidney disease, when you find you have edema, either from legs edema or you have the hematuria, or you find you have very sore pain of the lower back, weakness, all these symptoms could suggest you will have kidney disease. Of course, some people would have some kind of, in the morning, they saw her foamy urine. The urine is kind of a low foamy. So this also may be of the signs the kidney disease. You should see your primary care doctor or specialist. When you confirm you have the kidney disease, especially the doctor told you that you have the chronic kidney disease, then how do you do? First of all, you have to control your diet. The kidney don't like salty food, so you have to limit your salt intake. Second thing that you have to control your related disease like hypertension, diabetes, lipid, uric acid. This kind of things you have to control to the certain level. The blood pressure for the chronic kidney disease, generally speaking, is lower than 135 over 80. For the sugar, if you have a diabetic nephropathy, the general rule is you have to control your HbA1c less than 7. For the cholesterol, the LDL level should be less than 100. Uric acid level, you should control under 6. So that's the thing that for the kidney disease, the key is control diet. We don't have magic medication for prevention kidney dysfunction progression, but if you control your risk factors, you will slowing down the progression and prevent you for the dialysis in the future. I'm going to talk about hypertension. The essential hypertension is caused by the multiple reasons. Some genetic, some is caused by the diet, which is also, again, this diet is very important. We should control the blood pressure to prevent complications such as stroke, heart attack, or kidney failure. Generally speaking, the blood pressure should control under 140 over 80. But if you have kidney disease or heart disease, the preferred blood pressure control is less than 135 over 80. Of course, you also have to control your cholesterol and the sugar level. The hypertension could caused by secondary reasons such as endocrine hormones or kidney disease. Some hypertension blood pressure is higher and need multiple medications to control. To better control hypertension, you should modify your lifestyle and the diet. Of course, you have to limit your salt intake, low sodium diet. You have to do the proper exercise. Don't have to be a very strenuous exercise, proper exercise, and also quit smoking. Moderate or to lower amount of the alcohol, wine is okay, but don't drink too much. If you are using 3 blood pressure medication maximum dose still not be able to control your blood pressure, we call this as a refractory hypertension or resistant hypertension. Then you should see the specialist, usually is nephrologist, to find out what the cause is. Is it compliance issue, or it's because secondary reason like endocrine hormones or underlying kidney disease. And in that way, you have to see the specialist to figure it out and modify a medication for better control of blood pressure.